Okay, welcome everybody to this webinar on tools for dealing with Lyme and mold related illnesses. My name is Dr. Sandeep Gupta, and I'm very pleased to have Dr. Nicola McFadzean Ducharme here with me today. And how are you today, Dr. Nicola?
I am doing great. Thank you so much. And it's so wonderful to be with you.
Thank you for joining us. And yeah, I think this is going to be a really important webinar because there's a lot of information out there regarding these illnesses, regarding Lyme and stealth infections and mold, but sometimes it's the practical points where many of our clients and patients can get stuck. And sometimes these fine points of dealing with Lyme-related illnesses or mold are some of the things that aren't talked about in as much detail. And so hopefully we can cover some of those fine points today and give people some practical pointers which will help them to move forward in their journey with these illnesses.
Yeah, I'm all about practical. That's great.
Excellent. Thank you. Okay. So really what we're going to be covering in this webinar is not medical advice, is the first thing that we wanted to mention. And so we'd first ask if people may be able to give us their full attention, and if possible, please close or minimize other browsers and have a pen and paper ready, because you may find that there will be some tips that you may like to record for later. So as we have in this disclaimer here, this webinar is for general information only and not intended to diagnose, treat, or cure any medical condition. It assumes that you are under the care of a licensed health practitioner. And also we should make it clear that the information given in this webinar and the terms used are outside the parameters of conventional medicine and fall under the scope of integrative medicine. So this webinar will be describing supportive therapies for Lyme disease, Lyme-like illness, other stealth infections, and what we colloquially call mold illness, which the more technical term is chronic inflammatory response syndrome due to water-damaged buildings. Well, that's a mouthful. So it doesn't go into the diagnosis or primary treatment of these conditions and the exact protocol. And just to disclose, there may be a small affiliate referral fee for the courses that the reader purchases related to Lyme-Ed and so on. And we will be discussing a bit about the two courses, one on mold-related illnesses and one on Lyme towards the end of the webinar. So we hope that you'll hang around and hear some of the information about these courses that could be a very useful source of information for you. Thank you. Okay, a little bit about me. So those who have been tuning into these webinars are probably sick about hearing about me already. But really, as you would know, I'm a physician from Australia. I graduated from the University of Queensland in 1999 and worked in a hospital intensive care for around 5 years in the city of Brisbane, Australia. I now have a private holistic medicine practice in the Sunshine Coast and also in Sydney, and also do Skype consultations worldwide for those who are looking for help with these sort of conditions. I was lucky enough to be the co-author of, the sole author of the Surviving Mold Down Under paper, which luckily helped people in Australia to break ground regarding finding resources and tests and so on for chronic inflammatory response syndrome, which at the time was a very new condition. And also was lucky enough to be the co-author of the physician's consensus statement with Doctors Ackley, Bernstein, Rappaport, McMahon, and Shoemaker, which was in 2005. I've also launched a teaching institute, which I've named the Lotus Institute of Holistic Health last year, and also have joined the new society, which is known as the International Society for Environmentally Acquired Illness, or IC. And there's some of my web links below if people want to check out some of my work a little bit further. Thank you. And Dr. Nicola, would you like to introduce yourself a little bit to the viewers?
Sure, yeah. So I qualified as a naturopath in Australia, and then I moved to the United States. So, you know, I still call Australia home for you Aussies listening in, but I've lived here for 20-something years. So I got my doctorate of naturopathic medicine from Bastyr University. And went into private practice in 2003. I spent a couple of years really specializing in autism spectrum disorders, and then was starting to see parents of kids with autism and testing them. And, you know, I was very much into functional medicine, which is evaluating the imbalances in the body that can contribute to health issues, whether or not it's termed disease is, you know, another whole thing. So I started working with Lyme patients in about 2005 and just found it came up, you know, time and time again on the radar. So that's really been my specialty since then. Now I would say 99.5% of my practice is Lyme. I've written 4 books on Lyme disease, the Lyme diet, which was coming up on 10 years ago now, which feels crazy to me. Lyme disease in Australia, Beginner's Guide to Lyme Disease, and then Lyme Brain, which was published a couple of years ago. And I've recently released a course called Lyme-Ed, which is, there's a patient-based version and there's a practitioner-based version. And just trying to, again, help educate and support patients and practitioners in the treatment of chronic Lyme disease.
Great, thank you for that introduction. And so just starting to talk a little bit about Lyme-like illness and mold-related illnesses. And one of the big conundrums for many people who are starting to investigate these conditions and consider the possibility whether they may have one or both is trying to understand why these conditions often coexist. And I guess one of the big things, Dr. Nicola, is that it seems that there's a certain genetic susceptibility that many of these patients share. And do you find often that you notice that patients have a genetic susceptibility to both these conditions?
Yeah, I do. So I think there is a genetic susceptibility and sort of a predisposition. And then I think it's sort of this perfect storm idea where, you know, if the immune system is taken out by one thing, then it's so busy and stressed trying to handle that and potentially suppressed to handling one big issue, being chronic infection or mycotoxin illness, whatever, that then anything else is just above and beyond. So I think it is a genetic predisposition. And then I think there's also a total load issue of like how much can any one immune system be expected to handle?
True, yeah, that's right. So when the immune system gets hit by one insult, if you like, it can be like, for instance, if one gets a tick bite, this can create a cytokine storm, which means a series of inflammatory chemicals that can be released in the system, and that can actually affect the expression of these genes, which we call HLA genes, and make us susceptible to water damaged buildings or mold, that even if you may not have been prior. So I find that to be a really interesting interaction, actually, how that works. And I've seen that many times in clinical practice where people say, for instance, I was living in a moldy building, but it wasn't until I had a tick bite that all of a sudden then I started really noticing it was affecting me. So that's a really, really interesting interaction that seems to occur. And as you know, both seem to involve biotoxins, meaning these small negatively charged particles that are released from mold species such as Aspergillus and Chematomium and Stachybotrys and so on, and also from Lyme organisms such as Borrelia and Babesia. And it seems that these biotoxins in many cases are what seems to trigger this chronic inflammatory response. And in our course, Mold Illness Made Simple, we relate or refer to that as the silent fire of inflammation, which is occurring in people's body. And it seems that sometimes there can be multiple triggers that contributes to this silent fire of inflammation. Have any thoughts regarding that, Dr. Nicola?
Well, I agree. I mean, I think inflammation is such a big deal. And I feel like a lot of attention is paid to detoxification. And I don't disagree with that. I think detoxification is huge. And I'm a big proponent of it. And it's the first thing I do with my patients. I think we detox before we do anything else. But I slightly feel that inflammation and that inflammatory cascade is a huge piece of what our patients experience, whether it be Lyme, mold, both, heavy metals, whatever, you know, some of these big triggers. And so I think that inflammatory cascade is a huge part. And I realized that when I wrote Lyme Brain and I was sort of evaluating, like, okay, so people have brain fog, people have cognitive dysfunction, memory loss, word finding issues, all of these different things. Like, what's going on in the brain? Is it all infection? Is it toxicity? And really, there are a few things I feel going on, but one of the big ones is inflammation. And I think that that's something that gets sort of a little bit sort of secondary consideration. It's like, oh, I have inflammation if my joints hurt. But no, I mean, there's so much inflammation in the body that I think that needs to be one of our primary considerations, up there with detoxification, I feel. But I feel like inflammation gets a little bit second fiddle.
Yeah, I know what you mean by that, actually. And I think this work by Dr. Richie Shoemaker seemed to really bring the importance of inflammation right into the forefront a little bit more. And for me, it seemed to be quite practice changing. And I think for me, one thing also, as an additional point, one thing I had as a concept was that, for instance, if a person had a stealth infection such as a Lyme-like illness and one had inflammation, it was simply a matter of treating the infection and the inflammation should go away. However, interestingly, what appears to happen practically in some patients is that one actually needs to address the inflammation as part of it, or maybe even first, for the infection to go away. Like, it actually seems to create a block to some degree in and of itself, which is very, very interesting. Thank you.
And I think when people think about Herxheimer reactions, which we talk about certainly in sort of Lyme-like illness and treatment of, with antimicrobials, that we all talk about Herx reaction. And I think, again, there's a common thread that Herx means you need more detox. Well, yes, I think Herx does mean you need more detox, but Herx also means there's an inflammatory cascade. And, we need to cut through that and get to the root of that. And I feel like that's so much of what's happening with the mold illness. And, I'm interested to hear your thoughts, because what comes up for me a lot is like, do we treat Lyme first? Do we treat mold first? And for me, it feels a bit sort of contextual in that people come to me as a Lyme expert and we're treating Lyme, and then along the way we're looking at, okay, what else is getting in the way? So then I'm looking at heavy metals, I'm looking at adrenals, thyroid, hormone imbalance over like reproductive hormones, oral infections, EMF sensitivities. I mean, all these different factors that we're trying to evaluate along the way. And a big one now, I mean, huge for me in the last 2 to 3 years, is a realization that mycotoxin illness is massive and probably the biggest hindrance of recovery from Lyme and related infections. And so I think one of the common threads is the inflammatory reaction. And yes, we and you and I as clinicians need to be, but also our patients need to be considering, like, how can we reduce inflammation as well as supporting detox in terms of bridging the gap between treating Lyme and treating mold.
Yeah, great points. Yeah, and I look forward to expanding on those more as we go along. So next slide, thanks. So now, just changing gears a little bit, I thought it'd be great for us to start talking a little bit about what are some of the 10 biggest mistakes people might be making on their journey towards Lyme and mold. And myself and Dr. Nicola have both put our list together here. And some people would, just before we start talking about it, I want to make the point that many would say, in a philosophical sense, that there's no such thing as a mistake. There's only learning. And I'm a believer in that statement, that really this is all just part of our learning. And so it's also very important that we don't beat ourselves up around little things that we've missed along the way. And really, we just take them as positive influences or positive learning that we take along the journey. And for instance, I want to make the point that when I was suffering from mold-related illness and I realized that I and my partner at the time were living in a very water-damaged building, one of the things we did was just immediately find a new building that was quite pristine from a mold perspective. But what we did was we moved all of our furniture that was contaminated to the new residence. So we did one of the 10 biggest mistakes. But on the other hand, if I hadn't made that mistake, I wouldn't have realized the importance of that step, and I wouldn't have been such a big advocate of that for other people. So in a sense, I just wanted to make that point that there's a beautiful learning we make every time that we make a mistake. So I don't want to frame this negatively, but they're just little learnings that we've had as clinicians because we've dealt with lots of people and we've looked at lots of cases. They're just little learnings that we might be able to add. So jumping right into it, my 10 biggest mistakes in dealing with mold and Lyme are not addressing the inflammatory side of the illness. And we've talked a lot about that already. Putting no or little emphasis on diet. So sometimes I've found that people can get so much focused on this condition of Lyme or mold or whatever it might be, that all the attention is on seeing it as an external invader and finding out how they can find the next best supplement or medication or bit of information about that. But some of the basics, like eating well, get missed along the way. So I want you just to bring that into the awareness. And if that's something that you might be doing, it's simply a matter of just shifting the awareness a little bit and just seeing what little things can you do to improve your diet so that you have even better a foundation for your healing program for Lyme or mold. Number 3, not having a regular detoxification program. And I think that's pretty self-evident that if obviously through the treatment program, there is going to be a lot of metabolites, you could say, that are coming through your system. And if you don't have any detoxification programs such as infrared saunas or colonics or coffee enemas or anything like that, then that may cause a block for you in moving forward. So number 4 is putting no or little emphasis on emotional release techniques. And generally people, it takes a while to twig as to the importance of emotions on this journey. And I'll go into this later a little bit further, but really just realizing that one part that can be a major block on the journey of healing from Lyme or mold is the stuck emotions in our system, and not having any way of addressing those on a regular basis can definitely pose a block on your journey towards wellness. Number 5, not having a solid and healthy lifestyle that supports healing. So an example of that would simply be not getting enough sleep. So for instance, if you're up really, really late on the internet and reading all about your illness, even though it's really great to inform yourself and so on, that can be counterproductive. So we want to make sure that you're getting the basic lifestyle in place and getting enough sleep, getting enough water, etc. And just making sure you've got those basics in place, getting some regular exercise, getting some fresh air, getting some sunshine. All of these are just really basics of a healthy lifestyle. Number 6, not staying on antimicrobials for long enough. I'll leave that one to Dr. Nicola to talk about, but that's an important one with regard to Lyme. Not totally getting out of mold exposure. That's a really, really important one, and I think it's pretty self-explanatory that if you're still getting exposed on an ongoing basis, it's going to be very difficult to totally disarm your inflammatory process. Number 8, moving contaminated possessions to a new clean residence. I did it myself, as I said before, and it's a major trap. And so really it's just a knowledge piece that when you remediate or you move to a new residence, you need to make sure that any contaminated items are dealt with along the way. And that's a really important point. Otherwise, you can recontaminate your new residence. Number 9, not addressing MARCoNS. MARCoNS stands for multiply antibiotic resistant coagulase negative staph. They're often found in the deep nasal passages. If you don't look at them, that can be another inflammatory trigger that can still be lighting the fire of inflammation in your body. And that can be one little nail that you haven't pulled out along the way. Very simple to check for with a nasal swab sent off to Microbiology DX. Any practitioner can order it. And number 10, not using toxin binders such as cholestyramine, etc. And occasionally you find some people even in the mold world who are working just with antimicrobials and just with mold killing agents. And often that is not going to be enough, in my opinion. So those are my 10 biggest mistakes. I'd like to hand over to Dr. Nicola for her talking about what are her 10 biggest mistakes.
Well, and what I like about this is that some of our 10 biggest mistakes or challenges or hurdles are definitely consistent. So for me, putting little or no emphasis on diet, I am such a huge advocate for people adjusting their diet and doing whatever dietary modifications they can, because in my mind, one of the key drivers of inflammation is foods you're eating. So I really feel like, gluten is like #1 inflammatory food. Dairy is also fairly inflammatory, or like pretty inflammatory. Sugar has its own issues, which are more sort of, in my view, immune suppressive and feeding candida and things like that. But for me, if you're sitting there and you're at home and you're unwell and you're dealing with all these chronic burdens on your health, why not work with what you have the most control over? Because it's the day-to-day changes that you make and that, that you can facilitate in your own life that are ultimately going to make the most difference. And, practitioners like Sandeep and myself, we're absolutely committed to your health and absolutely committed to making a difference in your life. And we'll do everything that we can, but we need you to do your stuff too. And to me, the nutritional element, the dietary element, my patients that really just go for it and make those dietary modifications by far do better in the long run, by far, even in the short run. I mean, people are so profoundly impacted. So I'm a huge advocate of that. I wrote the Lyme Diet 10 years ago. It's still very popular today. I've been so honored and so blessed by that. But what it tells me is people want this information. They want to know what can they do for themselves, because I feel like mold illness and Lyme, they're so disempowering. They're chronic illnesses. They're challenging. There's a lot of things to overcome. And dietary modifications are one thing that people can take into their own hands and really sort of take command of. So I would really encourage you, if you're listening, to just take that to heart. Like, it makes a huge difference. I get it's hard. I mean, I realize how big of a change this is that we're asking you to make, but I promise you it'll be worth it. So that's sort of my number one. Not having detox strategies in place before doing antimicrobials, I feel like that's a big mistake. I always do that with my patients. Like, start detoxing first, even if it's only a week before. Just make sure those things are in place. And I think, there are some supplements and herbs that can really help. I'm a massive fan of glutathione, and we'll talk about these a little bit later in the webinar. But just making sure that those bases are covered, I think, is big. I agree, not putting enough emphasis on emotional release and healing. I feel like that is huge. And again, don't get me wrong. I'm not suggesting for a minute that this illness is all in your head, or it's something, you're just depressed or just anxious and need to deal with those elements. That's not it. We know that these are very real physical issues, physiological problems that you're facing. And there are emotional things that keep us all stuck. It's all of us. And so I think, working on those things can just help that release and help bring those bubbles up to the surface, so that they're not getting in the way of recovery. Not adjusting lifestyle to support healing. So I've seen this a lot, people doing too much. Like, you can't burn the candle at both ends and allow your body that parasympathetic response to rest and digest. So when you're in sympathetic nervous system response, that's your fight or flight, flight or freeze. You're go, go, go. You've got to figure it out. You've got to make it work. You've got to keep going. You've got to hang tough. That all puts your body in sympathetic nervous system response, which is not your healing nervous system response. Your healing nervous system response is parasympathetic, but that requires you to slow down. It requires you to take some deep breaths. It requires you to find those mindfulness techniques. And that can be like trying to do too much. And especially, Sandeep, I don't know if you agree with me, when people get a little bit of recovery and they just go out, like hog wild to do everything they used to do because they're feeling well enough. But the body needs extra time. It needs healing time. Staying on antimicrobials long enough. I agree with that. Like, to treat these infections adequately, we have to give it a good amount of time. We have to treat 2 months beyond resolution of symptoms. That doesn't always mean 2 months on medication, but 2 months on some kind of antimicrobials to make sure that we've got the job done. Not addressing all 3 forms of the Borrelia bacteria. So this is quite Lyme specific now, but it's one of the things I'm really big on is the Borrelia bacteria can exist in 3 different forms: spirochete, cell wall deficient, cyst form. If you're doing one antibiotic to address one form, my opinion is you're missing the boat. Like, we have to be comprehensive in the different forms of the antibiotics or antimicrobials to make sure. Now, that's more related to antibiotics, less related to herbal medicines. But my view is if patients are on antibiotics, we have to be hitting all 3 forms. We have to be hitting co-infections. If we're missing co-infections, that will also hamper recovery. I've seen lots of people treated for Lyme with the bacteria that address, that target Borrelia but miss co-infections. Similar for biofilm. Biofilm is a sticky goo that bacteria hang out in. They create it, they live in it, they're protected by it. Think of it like slime. I have a 4-year-old daughter with slime all day long in my house. So I think of it like that. It's like slime that bacteria exist in. Mold exposure, which obviously is Sandeep's specialty, evaluating that, getting out of current exposure, which can be really, really hard but necessary, and then using binders and other agents to address those mycotoxins, and then all the other stuff. And it's a lot, and it can be really overwhelming, and it's a process that happens over time. But heavy metals, adrenals, oral health, like amalgam fillings, cavitations that can harbor bacteria. There's so many different things that can come into play. I've recently been looking a lot at EMF sensitivity and the impact of EMFs on our health and how we can remediate that. So they're all different pieces of the puzzle that this is where it gets overwhelming, potentially, but if we can be systematic and if you can have a healthcare practitioner that can help walk you through the different pieces of that puzzle, I think that's where it gets really important.
Great, thank you for that. And hopefully that was really helpful for people in just identifying some possible mistakes or areas where you could be tripping up along the way on your healing journey. So we're going to jump through this pretty quickly because we've already covered it in a fair bit of depth, but just really talking a little bit more about how we can address inflammation and help your immune system and deal with pain. And one of the key things is to reduce the exposure, and particularly that's going to come in the way of really trying to remediate your home environment and also trying to just avoid any building exposure that may trigger you from a mold perspective. And I guess from the Lyme perspective, we're more looking at avoiding tick bites, I guess, is going to be one of the key things for future in really just lowering the amount of exposure we're getting to these bacteria. And then binding the toxins with binders such as cholestyramine, bentonite clay, zeolite, charcoal, etc. All of those can really greatly help to reduce the burden of toxins. Number 2, treat other conditions. So there can be a whole bunch of associated conditions with Lyme and mold, and some of them include what we call pyroluria. And there's a lot of information for that on the web if you want to look that up. Electromagnetic frequencies can be an issue for many people. Heavy metals, as Dr. Nicola already mentioned. MARCoNS, as I mentioned. Dental issues can be a big issue. And if you haven't had an assessment with a holistic dentist at some point, I highly recommend that. Methylation can be an issue for some people. And for some of us, doing one of the panels on methylation can be extremely helpful. Looking at mast cell activation syndrome, or MCAS, can be a really, really important part of this. And especially for people who are finding they're not able to tolerate any of the treatments and who are getting a lot of rashes and flushing and reactions to food, that can be a really important thing. And some people that needs to be addressed before they can tolerate any type of pharmaceutical or even natural supplement treatment. And then also looking at hormonal imbalances. Then there are some specific herbs and pharmaceutical agents, but mainly herbs actually, that seem to be very helpful for reducing inflammation. And these are some of the ones such as curcumin and resveratrol and boswellia. I'm sure these are supplements you use regularly, Dr. Nicola. And proteolytic enzymes can be extremely helpful for lowering inflammation. There's one product called Cytoquel from Research Nutritionals that we find to be particularly helpful. There's various forms of vitamin C which can be very immune modulating and beneficial. Particularly, I'm a fan of whole food vitamin C. There's various transfer factor products that can really help with certain aspects of the immune system and boosting natural killer cell activity. Beta-glucans are a supplement which come from medicinal mushrooms, which can be really, really helpful. Astragalus, colostrum, etc. And look, this is a whole alphabet soup. And really, I guess that's where working with a practitioner can really come in handy to help you know which particular supplements may be helpful in your case. And also from a more pharmaceutical point of view, the low-dose naltrexone, which is used, it's a medication which is actually used for alcohol withdrawal, but it's used in a very much lower dose in these sort of situations, usually at around 4.5 milligrams taken last thing at night. And that can be a very, very beneficial supplement for boosting the immune system and helping inflammation. PEMF is a new kid on the block. It's also called pulsed electromagnetic field therapy, hyperbaric oxygen therapy, ozone therapy, cold thermogenesis. And also, I mean, one of the really key things in the mold protocol is the VIP nasal spray, which really has a very profound effect on down regulating many of the inflammatory related genes. So just to give you guys an idea, there are many, many things. And then looking at the gut can also be very, very important, such as looking at an anti-inflammatory diet. So simply, as Dr. Nicola said, just not taking in foods which are going to be accentuating or worsening the inflammation process is very, very important. Looking for food sensitivity. So many people get food sensitivities when they're dealing with these syndromes. And one of the reasons is that leaky gut is very, very common. And you may like to look back to our webinar that we did with Dr. Rabar earlier this year, where we talked about leaky gut and SIBO in the context of mold illness. Making sure you have a good source of filtered water or spring water. That's another really, really important thing. And treating microbes such as parasites in the gut, making sure you don't have small intestinal bacterial overgrowth, and just looking at bacterial imbalances in the gut. And I guess that's going to be particularly important if you've had antibiotic therapy at some point, which is going to have an effect on your gut flora and really mean there's going to be a big need for rebalancing it. Okay, so that was a huge download there in a couple of minutes. Anything you'd like to add to all of that, Dr. Nicola?
Well, I mean, I agree with all of it, but I think, you know, the inflammation, the low-dose naltrexone I've actually had really good results with. I really am a big fan of low-dose naltrexone. Sadly, it doesn't work great for everybody, but the side effect profile, I think, is quite low. Some people just don't seem to have a positive response, but what I like is it's an immune modulator, but it also can help with pain, energy, mood, and sleep, which are really four of the big things that our folks deal with. So I'm a big fan of that. And just, reinforcing. So for inflammation, I lean first towards the herbs, like the white willow, boswellia. I use a lot of frankincense essential oil for inflammation, which I really like. And then sort of secondarily, I use proteolytic enzymes. But I think one of the messages that I think we're on the same page, Sandeep, saying today is that, you know, inflammation and detoxification are two things that are central to Lyme and mold. They're the things that come in common. Reducing inflammation, helping detox, and binding. And so, you know, those kinds of things I think are really key. But yeah, no, I agree with everything that you've said. There's so many things to look at, and this is where it is good to have a good practitioner to sort of help navigate. But there are also lots of great options and a lot of great natural options too that are, you know, in sync with the body, not against it.
Great, thank you so much. And just we'll add one website that people may like to look up, which is ldnresearchtrust.org, if you want to look into low-dose naltrexone a little bit more. So jumping along here and talking a little bit more about supporting detox and elimination. And would you like to maybe talk about this one, Dr. Nicola, and some of the things you recommend?
Detox is looking at liver support. There's phase 1 and phase 2. And then elimination is the other half of detox. So you can detox all day long, but if toxins aren't getting out of the body, then that's a problem. So we have to make sure the bowels are working, the kidneys working. That's where sweating is good, with sauna and things of that nature. So we want to help the liver. I'm a huge fan of glutathione. The antioxidants are good for phase 1, so A, C, E, selenium, zinc. And then I feel for phase 2, like some of the herbs are great, like dandelion, milk thistle, things of that nature, artichoke. And then liposomal glutathione is really a core of many of my protocols. So there's lots of different things. The one thing people can do at home that makes the most difference in my view is coffee enemas. I've said to lots of patients now, I'm sorry, but everyone says coffee enemas help. And they're like, oh, really? Oh, okay. And then they come back and they go, oh, you were right. Coffee enemas definitely help. So coffee enemas, I'm a huge fan of, like even over and above sauna, over and above anything else. I have found the AMD Ion Cleanse foot bath has been superb for a detox because it not only pulls the positively charged, toxins, but it also pulls some of the negatively charged. So ammonium, mycotoxins, glyphosate, which is a massive problem in our society, I feel. So anything like that, skin brushing, any Epsom salt baths, things like that people can do really simply at home for not a lot of money are really big detox helpers. And then you've got to get the bowels moving. If the bowels aren't moving, it's all over. So vitamin C and magnesium are two of the sort of natural ways to do that. Ground flaxseed, psyllium husk is a little bit more irritating, but if need be. Just anything, whatever it takes, like fiber-wise, vegetables, things like that to get the bowels moving, vitamin C and magnesium, bulking agents. We've got to get that elimination. Otherwise, it's only half the equation.
Right. Yeah. Thank you for that. And yeah, I would second the information on the coffee enema. And most people, when I mention it, they think, you're going to do what with coffee?
Yeah, I know,
it's such a bizarre sounding thing at first pass. But what I suggest is do a bit more reading on it. Particularly, I think, have a look at what Ralph Moss, PhD, has written about it. And he's done quite a lot of specific research on it, and have a look at the research. So, for instance, it was found to significantly increase bile flow, and it's been found to increase an enzyme called glutathione S-transferase by 500%. So it really does have a science behind it. It actually seems to work as a natural dialysis for the liver, and it greatly increases the amount of fat-soluble waste that are able to be detoxified. So please do a bit of research on that. There's also a lot of YouTube videos about it. So check it all out and try to understand the science a little bit more and consider giving it a go. Thank you.
I agree. And I think that there's a detox element, and there's also a lot of people now who are talking about parasites and helminths and coffee enemas are a way to clear some of the nests of candida overgrowth and things like that. So I think there's so many different benefits, and I'm actually going to look up that resource. I have found Dr. Wilson has a very good article about it, so that's where I send people to. Just Google Dr. Wilson coffee enemas.
And Lawrence Wilson, yeah.
So I think that's really comprehensive. It explains how to do it, but also why you're doing it, the mechanisms and things like that.
Yeah, great, thank you. And I think I think the site is drlwilson.com.
Yeah,
that's a really good one. Okay, so jumping into diet a little bit more, I think we're not going to go into a huge amount of specifics here other than to mention that there's a whole bunch of diets around, but there are some real basics. And if you feel overwhelmed by all the different dietary options, sometimes the best thing is just take it back to first principles again. And the first principles is you want an anti-inflammatory diet. And some of the key things that are going to cause inflammation in your diet are, firstly, processed foods of any kind. Secondly, gluten of any kind, but particularly wheat products. And really, if there's one simple thing you can do, is to try and simply exclude as much as possible wheat and gluten products and artificial additives, as Dr. Nicola said. That's a really good place to start. So it's important to realize you don't have to be perfect, and it's what you do the majority of the time that makes the difference. And the reason I say this is that I don't want you guys to feel too overwhelmed about diet and leave it, but rather if you can make some simple steps to improve your diet and keep improving, all of a sudden you'll realize that you've made a huge difference that you probably didn't even think you could with your diet. So as far as possible with regard to your animal products, or actually all foods, if you can get organic foods as much as possible. Now, yes, they are a bit more expensive, But if you go to farmers markets, for instance, often you can find organic foods that are at the same price as conventional produce. If you Google the dirty dozen, you'll find the 12 foods that are the most sprayed, and they're the foods that are the most important to have organic. And then there's also the clean 15. So if you want to start with making a bit of a compromise, and I don't know if you tell this to people or not, Dr. Nicola, but this is what I think for starting off. Maybe it's a little less overwhelming. That if you look at the clean 15, maybe they're the foods that you can continue to get from the conventional store to start with, and just focus on making sure you get the dirty dozen in organic. And that can be a really good way of just transitioning over to more organic foods in the diet. It's a simple thing. The other things that's really, really important is corn and soy and canola oil, which I'm really hoping that you're not having anyway. But they're going to be the foods that are almost always genetically modified. And so it's really, really important with those foods to make sure that you're always getting organic. A diet high in vegetables. Almost all studies have found that getting a high amount of vegetables tends to help with inflammation and tends to help with longevity. And that's partly related to the phytonutrients, which are in vegetables, particularly such as resveratrol and lycopene and a whole other range of amazing plant-based nutrients that really feed the genes of your body. Number 4 is a low sugar, or a diet that's generally low in refined carbs is generally going to be the way to go. And there's a whole bunch of reasons for this, but without going into too much depth, I guess one simple way of putting it is that everyone in the population is somewhere on the road to diabetes. It's not really just that some people have diabetes and some people don't, but rather it's a spectrum. And we call that the spectrum of insulin resistance. And if you're suffering from any of these kind of stealth infection or inflammatory illnesses, you're going to be more likely to move along the spectrum towards the diabetes end. It's also the end where you're much more likely to get obesity and fatty liver and polycystic ovarian syndrome and high blood pressure and a whole bunch of other conditions. Now, the very simple way of reducing your risk and coming back down to the other end of the spectrum is taking as much processed and refined sugar out as you possibly can. And that includes refined carbohydrates as well. So that's my little spiel on sugar. And I think that's another really simple thing that people can do. If you're used to having a teaspoon of sugar in your cup of tea, try simply switching it over to xylitol if you can get, or stevia. I'm not saying that necessarily those foods are the absolute ideal, but that's a simple way in which you can switch over in the first instance, and then later on you may even not feel a need for it so much. And then the last thing is in general trying to go low in omega-6 fatty acids and high in omega-6s and omega-9s. If you don't know what I'm talking about, put Google to some good use, and please punch it in there and find out exactly what I mean by this. But these are different types of fats that are found in foods, and generally omega-6s are found in vegetable oils and in nuts, particularly, and basically processed foods in general are going to be much, much higher in omega-6s, while omega-3s is particularly found in fish and chia seeds, flax seeds, walnuts, and also wild game, wild meats particularly, apparently, is where you find omega-3s. And then omega-9s are particularly found in things like olive oil and avocados and other foods like that. So really emphasizing those healthy fats. And really what we're saying, and most of you probably know this by now, is that fat in and of itself is not bad. It's actually very, very healthy. But it's more a matter of making sure you're getting the healthy form of fats. So that's my little spiel on some of the basics. I don't know if you'd like to maybe jump into a little bit about specific diets, Nicola, maybe just quickly.
Yeah, so people say to me, okay, what should I do with my diet? And I'm like, okay, so step 1, no gluten. Step 2, no sugar. Step 3, no dairy, like in that order of priority. So, I mean, that takes some work and learning and adjustment. But that's how I prioritize things. The other things I'd add about sugar are, firstly, it's immune suppressive. So 1 teaspoon of sugar can suppress your immune system for up to 16 hours. So that's a big deal. Like, we need our immune system to fight for us, especially, you know, for those of you dealing with chronic infections and mycotoxin illness and things like that. You want to optimize your immune function. So sugar can really just kind of knock that down. The other thing sugar promotes is candida overgrowth, because yeast feeds on sugar. So fruit sugar, for those that don't have a significant candida issue, fruit sugar is sort of a natural sugar. So and there's fruits, there's vitamins and minerals in fruit, there's fiber, the sugar is more slow to absorb, so it's not as problematic as sort of white refined sugar. But that's my mentality on sugar, is it like doesn't do the immune system any favors. And yeah, I second that. Like, inflammatory foods, it's a massive source of inflammation in the body. And we don't want inflammation in the body. Like, we're trying to reduce inflammation on the body. So use your food, eat the anti-inflammatory fats, which, you know, in my view, are the omega-3s, your flax oil, your fish oil, things like that. Supplement if you need to. Have lots of the healthy fats like the olives and olive oil and avocados. Coconut oil is actually a really good one, for a number of different reasons that we don't have time to get into right now. But yeah, just really work on getting the gluten out and reducing the sugar. And I promise, when you stop eating sugar, your body will stop wanting sugar. You may feel like that's impossible. It may seem like, you know, that's not going to happen for me anytime soon, but I promise it will happen.
Great. Okay, so we'll probably skip over this, but there's a bunch of Lyme and mold diets you can look into. Particularly, so Dr. Nicola has the book called The Lyme Diet, which I recommend checking out. There's also the standard, I guess, is more like a paleo or autoimmune paleo or bulletproof diet. It's worth knowing about the Know the Cause diet, which specifically focuses on eliminating mycotoxins. Ketogenic diet specifically focuses on going for a high fat content and a very low carbohydrate content in the diet, and is very, very useful for lowering insulin resistance. And then there's the raw food diet, which really aims on massively increasing phytonutrients in the system, and really it's a very cleansing diet. That can be very beneficial at certain stages of your health journey. It may not be always useful for long term. So these are definitely good things to look at. Okay, thank you. So just jumping into a little bit, I mean, and this is probably, we've already talked about this to a fair degree, but maybe just some very quick brush strokes around sleep, exercise, and lifestyle. As we said, you know, just realizing that lifestyle plays a very important part in your recovery from Lyme or mold-related illnesses is probably the underlying point here, and really just taking it back to the idea that this is all about you and your life. It's not just about the microbe or the illness, and that's really that's the bedrock of the holistic approach to these illnesses. And therefore, doing some gentle exercise within your limits, and realizing that many people who are suffering from these chronic inflammatory illnesses will have a point that you can hit with exercise. And for some people, that point is actually any exercise. But there'll often be a point that you will hit where you may start to crash. And that's what we call hitting your anaerobic threshold, where your cells are no longer able to use oxygen properly. And there's a whole bunch of scientific reasons for that. But basically what we're talking about, generally speaking, is more gentle exercises. So you may like to try yoga, rebounding, walking, Pilates, cycling, swimming, etc. And sometimes those who are into very, very extreme forms of exercise like Thai boxing and kickboxing and so on may find they have to tone it down a little bit. And that can come under the general theme of toning things down in life in general. And the universe likes to give us these messages in the forms of many different ways. And one of the ways in which it does it is in the form of illness. And that's a really important way to think about it sometimes, is that it's not just an inconvenience, or it's not just a microbe which has come in and ruined our life. This is actually about us and our interaction with the universe, if you say, or the divine or God, or whatever terms you like to use. And I'm really a big fan of trying to think of it that way, and take the whole holistic approach, and thinking and really using the thought that this is a chance for a whole life revamp. And that's what most people have to go through in recovering from these illnesses. So stress reduction and management is really, really important. Recommend yoga, meditation, mindfulness. If you are interested, there's certain things called flotation tanks where you can float in an anti-gravity situation in water and magnesium, and that's a very, very profound experience. You may care to check out my recent blog article at lotusholisticmedicine.com.au. And then really just making sure you're getting good quantity sleep. And I would say, I don't know what you think, Dr. Nicola, but that would be one of the most underestimated factors in recovery, in my view. And one of the key things is just going to bed early, in my view. Making sure you're not using electronic devices late at night in general. You might like to look into getting some blue blocking glasses, supplementing with melatonin, magnesium. Sometimes magnesium 3 and 8 can be more useful for people. I can't say I've had a huge amount of luck with it, but some practitioners have. But various forms of magnesium can be helpful. And then there's herbs such as valerian, passion flower, and hops, and other things like that, which can also be very, very helpful for relaxing. So that's a little bit on sleep, lifestyle, and diet. Maybe we can move on from here to touch in on psycho-emotional aspects and tools. Would you like to maybe touch in on this one, Nicola, briefly?
Yeah, I mean, I think it's I think we talked about it a little bit before that, you know, by no means are we saying that these illnesses are all in your head and they're all just you know, hanging on to this baggage and depression and anxiety. And that's not what we're saying at all. But we do encourage patients, or certainly I look at this, of, you know, what could be getting in the way? Like what is there that could either be stressing, taxing the adrenals, or just kind of stuck? Like we all have our wiring, we have our neuro kind of patterning. And if our neural pathways are stuck in trauma or stuck in negative thoughts or stuck in sort of things from the past, it influences our whole brain wiring. And everything starts at the brain. Like that's how, you know, especially with our limbic system, which is the sort of seat of emotions, but that can also influence physiological functions in the body. So just looking at those psycho-emotional aspects, I think, is really important. And, you know, step one is the stress reduction, because that not only balances the brain frequencies and patterns, but also helps the adrenals, which gets so trampled on in chronic illness. But the limbic retraining I have seen to be really, you know, quite profound, like the DNRS and some of those other things. I'm a big fan of energy psychology. I love, you know, EFT, which is emotional freedom technique, tapping technique. It's something that you can learn at home for absolutely nothing. There's all kinds of tutorials online, but it's such a good tool that can be practiced within a couple of minutes to diffuse anxiety, or to diffuse like pain cycles, or to diffuse negative thinking or hopelessness. And I feel like mindset is so important. So I feel like part of it is clearing the emotional traumas and the things that keep us stuck. And then the other part is being able to embrace a positive outlook. Because nobody wants you to pretend that everything's okay when it's not. But I will also say that a positive outlook, and that outlook of I'm going to be healed and I'm going to recover and I'm going to stay positive about that, I've seen it make a huge difference in my patients' outcomes.
Great, thank you. Yeah, no, I agree that emotional aspects to the journey are very, very big. And we have done previous webinars on this, and I recommend checking out the previous webinar with Dr. Samantha Clark, if you haven't heard that already, where we really go into this subject. Thank you. And we'll skip over relationship aspects, but it's also really important to realize that these illnesses can have a very important can have an important effect on your relationships, and there can be certain tips that can help you to get through this. But that might be a topic for a future webinar.
I feel like that's a whole webinar into itself.
Yeah, I think that would be great. Let's plan that one for future. Okay, so just now jumping on to talking about if you want to find out more about mold illness particularly, those who've been listening to these webinars already will be quite familiar, but there is this course called Mold Illness Made Simple, which I've developed. It's a 8-week online course that's on demand, so you can do it at any time. And basically there's 18 video lectures and slides which come with that you can listen to, watch, and download to get a really thorough explanation of how mold illness works and what the path to recovery is. It's not a course for everyone. I want you to know, I think you need to really be committed to doing at least a few hours a week for 8 weeks, and really at least devoting somewhere around 16 to 20 hours of work to getting through this course. However, if you do devote that time, I can pretty much guarantee from the feedback that I've had so far that you will feel a lot more clear and that your level of overwhelm will go down significantly. And I believe from my experience in this illness so far, in treating this illness, that those two factors are very, very important in getting to recovery, and that it's very important to feel clear, and it's very important to not feel overwhelmed, because when you're feeling confused and you're feeling overwhelmed, you're in fight or flight response. You're working in the limbic system, and that's part of the illness. And so a really big part of recovering is to getting to the stage where you feel that you have a good grasp on what's going on and what you need to do to recover. So that's what the course offers. The people who have spent the time to go through the course and complete it so far have said that it's been extremely useful. And so I believe that for the majority of people, it will be. And I really do have a heart for people suffering from this illness, because it can be very, very devastating. It can put you in a place in your life where you feel extremely stuck. And I want to see people getting through this illness, moving forward and becoming beacons of light for other people who are then starting to suffer from this illness. And it's getting to the stages of almost being an epidemic, really, these illnesses. And so really that's where I'm coming from, is really wanting people to move through overwhelm and get to a place of clarity. So that's what the Mold Illness Made Simple course is. We are offering a little bit of a discount to people who are coming today, and we'll get to that in a moment. But before we do, I'd like to hand over to Dr. Nicola to talk a little bit about her course, which is called Lyme-Ed.
Yeah, so I created Lyme-Ed because I feel like, as much as I love my patient interactions and one-on-one contact with people, there's a lot of people out there that are looking for information. And I wanted to present a really integrative kind of approach. So Lyme-Ed is really every single thing I know about Lyme disease is in this course. It's 25 hours. There's 10 different modules. I first created a patient version of Lyme-Ed, which is for the layperson. It covers everything from signs and symptoms, how to test, what other tests to run, antibiotic protocols, herbal protocols, 10 things that can hamper recovery, emotional strategies for recovery. There's a whole module on digestive issues in Lyme, a whole module on hormonal imbalance in Lyme. So it's really as comprehensive as I could possibly make it. There is a practitioner version as well, because I think that's one of the things that's so crucial, is to get more practitioners trained and familiar with Lyme and chronic Lyme and what that entails. So there is a practitioner version that offers more ongoing support and training for practitioners. But essentially, yeah, my heart is for my Lyme folks. You know, I love my patients and just wanted to get my knowledge and experience out to a broader base. And so that's kind of where Lyme-Ed was birthed, and I just made it as comprehensive as I could. But I feel like, you know, one of the things, without being braggy, is like, you know, I'm able to break things down into manageable chunks, and I'm able to make information relatable to people. So even though it is very content dense, it's all broken down by module, it's all broken down by lesson, so people can go back to it later and go, okay, I'm struggling with this right now, let me go back and re-listen to this. It's lifetime access. And so it's all there and available on an ongoing basis.
Yeah, and I do highly recommend Dr. Nicola's course for those who are trying to understand Lyme-like illnesses and really get a good versing on what's going on. So for the next 48 hours, if you use this coupon on either course, so that the coupon will work with either, and we'll have the link below the YouTube page here, so you can click on that and get a significant discount. So there's The Mold Illness Made Simple course just has the one price of $199, and that's discounted to $159.20. And Dr. Nicola's course, there's the patient version or the practitioner version. And so the patient version is discounted from $197 to $157.60, and the practitioner course from $397 to $317.60. So look, this is really for people who are looking to get a really solid base of information in either or both illnesses. It's an opportunity to really take what we've discussed on the call today and really go into a lot more detail of all of the aspects of recovering from these illnesses. So we hope you'll avail of them, and we'll now just take a few questions if there are any that have been asked. We'll just take a moment to pool the questions and see which ones might be the most suitable. Okay, do we have any questions? Okay, well, let's jump in before we take any from the audience. Would you like to talk a little bit, and we started with this at the start, Dr. Nicola, about what would you say is the best order of treatment if someone appears to be suffering? Let's say they're living in a water damaged building and they've also had a tick bite and tested positive from their condition with IGNX, for instance. Which of the two conditions would you suggest they start addressing first, or do you feel that it's really just a matter of working out, for them, which is a bigger priority?
Yeah, I mean, I slightly do. And I mean, to just put it in context, and I don't know if you feel the same way. Like when people come to me, they come to me for Lyme treatment. So they're coming for Lyme treatment, and then we're evaluating other things along the way. But I feel like what's important, and this is sort of really what I hope people take home from our webinar today, is to look at what is in common with those two things. So looking at the inflammatory cascade, looking at detoxification, looking at what to do with nutrition and lifestyle. I mean, there are things that are consistent between, whether we're talking about mold illness or Lyme infection or heavy metal toxicity or oral infections. I think one of the most important things is to look at the common ground first and say, what can we do to help both things? Well, we can reduce inflammation. We can use binders to bring down the toxin load, and things that can help both. I mean, I'm a little bit more skewed to the Lyme treatment because that's kind of what I do. And so I think in some ways, I mean, the practicality of it is that does influence how we treat people. It's like they come to us for this is our expertise, this is what we provide, as we're looking at different things that can be stresses for them. But I think the bottom line is look for the common ground, look for the things that are going to help both.
Okay, great. If your home has been remediated and air, mold, and swab testing has been done and shows low level of mold and bacteria, but I still have a reaction from only 5 minutes in the home that will last for hours or days, what would we suggest as the next approach? That's one of the first questions that's been asked, Dr. Nicola. You're welcome to deflect back to me if you want.
Yeah, you take that. That's your expertise.
Okay. Well, my response to that one is that really it's the response that's most important, not the testing, actually. And so if you're finding that you're having a reaction, then that is that in a sense is the most important thing, because that is a clinical response. And ultimately testing is only a guide, and air testing and swab testing are considered to have significant limitations to them. Actually, all testing has some limitations to it, but most likely I would recommend in that situation to look at doing ERMI testing. So this person hasn't told me their full situation as to whether they've already had treatment and so on or not, but generally speaking, I would recommend getting evaluation with a full ERMI test, and also having the basic workup done for chronic inflammatory response syndrome, which includes the visual contrast testing and the cluster analysis, and possibly the HLA gene testing as a first point of call. I don't know where this person lives, but I would recommend starting there. And if you're finding that there are some significant species on the ERMI and you've got positive tests for CIRS, then you need to go further with further investigation with a IEP or an indoor environmental professional to look at what possible water damage may be present in your house. So certainly I would not take the air and swab testing as being full reassurance that your house is fine. So second question we have here is, can you talk more about mast cell activation syndrome sometimes? Because I've spent thousands of dollars on treatment for CIRS and SIBOs and have now got nowhere and then diagnosed with MCAS. So a lot of this info makes MCAS worse. So really just some basics on MCAS. Is there anything you'd like to share about that, Dr. Nicola?
Well, I mean, I think, again, diet can play a role with a low histamine diet, and there's some other sort of supplements in terms of vitamin C and quercetin and some mast cell stabilizers, and then some medications that can make a difference. But yeah, if that seems to be a dominant issue for someone, then that needs to be addressed first, because then, we can see even these sort of histamine responses to herbs and things like that. One comment I would make is I've seen NAET work quite well for reducing that overall sort of histamine reaction and sensitivity. That's Nandrolbipads, I always can pronounce her name incorrectly, allergy elimination technique, NAET. Yep. And that can be a good modality to sort of reduce some of that too.
Great, thank you. And I do recommend people also listen to the previous webinar with Dr. Jill Carnahan, and you can get onto all of these webinars by subscribing to my YouTube channel. Okay, number 3, can one expect the immune system to address Lyme or co-infections when mold is resolved? So do you have any thoughts or experience around that particular question?
Yeah, so I feel like if the mold issue is resolved and one is out of an environment where there's sort of further mycotoxin exposure, and that seems to be sort of a done deal, then we can ask the immune system to work better. I always feel that realistically, if somebody has chronic infections like Lyme, Babesia, Bartonella, those kinds of co-infections, that it's too big of an ask for the immune system to clean it up all by itself in the beginning. Like, one still has to do antimicrobial therapy, however that looks, to get the load down, whether that's ozone, whether it's antibiotics, whether it's herbs, because I feel like we have to bring the microbial load down in order for the immune system to be in a place where it can be like, okay, now I got it. But I feel like taking one of the factors like mold away, it definitely helps free up some space on the hard drive, if you will. But I still feel like antimicrobial therapy is important to get the pathogen load down so that then the immune system can kind of, regulate in the long term. But I feel like just dealing with mold if Lyme is there is not enough. I feel like the Lyme still needs to be treated specifically.
Great, thank you. Next question is it possible to have MARCoNS in the lungs? I can answer that one. So far, MARCoNS has been identified in the nasal passages and the throat and in the teeth and in vaginal swabs. So far, MARCoNS has not been reported in the lungs. However, if you have the suspicion, there is no reason you cannot send some sputum to Microbiology DX and have it cultured. And if you do find it, please let me know by emailing us at info@moldillnessmadesimple.com, because I'd really be very interested in that, and I would want to write that up as a case. Are coffee enemas okay if you have mast cell activation syndrome? Do we know?
I have a couple of patients who have mast cell activation syndrome who do coffee enemas and still get benefit. I'm not saying that's going to be true for everybody. I haven't had enough experience with those two things together to be able to say conclusively, but I have had a couple of patients that I know of who've had that and still did well with coffee enemas.
Great. Yeah, that's my impression too. One, and maybe the last one here, but how long does it take to see relief from mold exposure after integrating the steps to get better? I can take that one quickly. Look, the answer to that is that there is no particular exact time course, and it really does just depend on how many blocking factors you have and there's a whole bunch of factors actually. But if your only problem is mold exposure and you're not a very severe case, I would say that it should happen fairly quickly if you totally get out of mold exposure. If you do not find that you have great relief, that's where you need to start looking for other factors, and certainly then going on to toxin binders such as cholestyramine, looking at MARCoNS, and then looking for other causes of your illness is going to be very, very important if you're not finding the resolution that you expected. So next question about how useful is ozone in Lyme and Lyme-like illness?
I've seen ozone be great. I mean, I'm actually a huge fan of ozone. I like oxygen therapies overall. I like hyperbaric oxygen. I like ozone therapy. It can cause pretty big hexes. So sensitive people need to go slow in the beginning, but, and depending on the type of ozone done, there are a few factors that we check first. We look at ferritin, we look at G6PD, which is an enzyme that's required in the body. So there's sort of some precautionary things to look at first, but overall, I feel like ozone is a positive thing. And even with Babesia, which, you know, there's sort of an argument for like Babesia likes oxygen. So would we do ozone? Would we do hyperbaric oxygen? I feel like, you know, those therapies can still be helpful so long as the Babesia is treated, we've knocked it down, and ozone can be still a very healing modality overall.
Great, thank you. There was a question about just for the web address for low-dose naltrexone to be repeated, and that website is LDN researchtrust.org. So that's ldnresearchtrust.org. Okay, and maybe our final question here, because there's a fair bit of talking around this that we could do, is what is the most reliable Lyme test when one has HLA-DR haplotypes? I found a study that shows that some forms of HLA-DR haplotypes do not allow for the ability to make antibodies to Borrelia.
Well, that's the $1,000,000 question, isn't it? So with testing for Borrelia and related co-infections, I mean, I like to do a couple of different things now. I've always been a fan of IGeneX. I love the Western blots, understanding that, you know, a lot of Lyme patients are immunosuppressed and the antibody response isn't going to be, you know, sufficient to trigger that positive result. And so testing always has to be correlated with clinical presentation and history. So we know that about Lyme. I have now been using a combination of the IGeneX basic Lyme panel, which is an IFA and the Western blots. They're all immune, you know, they're all antibody responses. And then I've combined that with the DNA Connections Lyme panel, which is a PCR panel that covers Borrelia and co-infections. And I feel like those two things together kind of cover some of those bases, that if one is immunosuppressed, you know, you've got the second chance for PCR. The DNA connections must be provoked either with exercise or deep tissue massage or something like that, just to get the metabolism working, which I wasn't really sure about in the beginning, but now I've seen what happens when people do provoke it and when people don't provoke it. So I can vouch that that is an important step. And that's what I do. So then I get my co-infection testing with DNA connections. I still get my Lyme, Western blots, and IFA with IGeneX. And, you know, even with those two things, putting it together with clinical presentation and history. And sometimes I treat, and then response to treatment is part of my diagnostic workup as well.
Great. Yeah, that's right. And I think part of it is just the clinical experience side and the clinical assessment. And still, I think what ILADs are teaching is that ultimately Lyme disease and other tick-borne illnesses are still a clinical diagnosis. And I still would go back to that rather than the idea that there's a perfect test. But really having a good clinician often will be one of the best ways in which you can identify. And sometimes the response to therapy. So for instance, the person that asked about how quickly will I get relief from getting away from mold exposure? Well, some of those things are what can actually give a clinician a clue to whether you do have a Lyme-like infection in there. For instance, is if you don't have a complete response. to therapy for mold illness, that can be a very strong pointer to the fact that there is some kind of stealth infection. We find that quite commonly. And I guess you, from the other side of the table,
Exactly,
if you're treating Lyme, you find you're not getting a response.
Right.
Well, that's in some ways going to be as useful as any test for mold illness.
But in reverse, absolutely. Like if my Lyme folks aren't getting better with all the best treatment I can give them, then I'm like, okay, what else is going on here? What's getting in the way? And mold is number one thing that I look at now. So yeah, and the other thing is, I do a co-infection provocation. So I start a herb for Borrelia, then a herb for Babesia, a herb for Bartonella. And it's not a perfect science. There's no one herb in nature that's absolutely specific for one bacteria. But over the years, that's a process I've just developed. And I teach that in the Lyme-Ed course, actually, of trying to sort of nut out the co-infection piece and where's Lyme present, what co-infection is dominant, what's playing what role, what's contributing to what symptoms. And I have found that to be equally good to a lab test in terms of assessing Lyme and co-infections.
Great. Yeah, that's right. Yeah, sometimes a challenge can be another really useful way to do it. The other thing I'll mention is the ELISpot testing, particularly with Armin Labs in Germany, which is actually not specifically testing antibodies, but rather it's checking for the T cell response. In some cases, that can be a particularly useful test. They also test for co-infections, particularly mycoplasma, chlamydia, and also I'll just throw viruses into the equation as well, and particularly looking for things like chronic Epstein-Barr virus, chronic CMV. These are all things that you can look for. So
yeah,
really
this has been fantastic. I agree.
Great, thank you. So really this has been a really interesting discussion today, and I think there's just so much interesting research on this field of Lyme and mold that's coming out. And however, I really would like to emphasize just this idea of the holistic approach, and taking a holistic approach to these illnesses often will give you the best long-term solution. So I hope everyone's enjoyed this webinar today. I also want to do a quick plug for a training that we have coming up in San Diego as part of the functional diagnostic nutrition training for health practitioners. And that is going to be on the 26th and 27th of August 2018. I'd like to invite you guys to join the Facebook group Mold Illness Made Simple. So that is www.facebook.com/Mold Illness Made Simple, where we will actually post the information about that 2-day course. And also please sign up for our newsletter, because we do have regular offers and regular notifications of upcoming webinars. Is there anything you would like to mention in closing, Nicola, if people want to keep in touch with you and your work?
Yeah, if people want to go to restoremedicine.com, that's my practice website. Restore is RESTOR, no E on the end, and then medicine.com. And yeah, sign up for our newsletter and you'll get our notifications of webinars and blog posts and things like that come out.
Excellent. So a big thank you to you, Dr. Nicola, for coming along today and for sharing this really, really helpful practical information for people. And thank you for all your work in this field of helping Lyme patients. It's really heartwarming to see what you're doing.
Thank you. So great to be with you today.
Great. And also a big thank you to Caleb Rudd for content and technical support. We certainly could not do these webinars without him. So everyone, enjoy the rest of your day, and I really, really hope you've got some beneficial information out of this webinar today, and I hope you stay tuned for further webinars with us at Mold Illness Made Simple. Thank you so much.